Today I'm going to show you the proper techniques on how to give CPR to an adult victim. First thing you want to do is check for a response. You do this by gently shaking your victim and asking them, "Are you okay?" Next, you want to send someone to call 911. If you're alone, hopefully you have a cell phone and you can call yourself. Step 3, you want to spend no longer than 10 seconds assessing your victim. In that 10 seconds, you will be assessing their carotid pulse, located in their carotid artery in their neck, and you will also be looking for signs of breathing. A good indication of breathing is chest rise and fall. So spend no more than 10 seconds assessing breathing and assessing pulse. If you detect no pulse or a weak pulse, less than 60 beats per minute, your victim needs CPR. When giving CPR, you want to make sure that you have proper hand placement. You want to put the heel of your dominant hand on the lower portion of the breastbone or sternum. I'll demonstrate. Take the hand you write with, place the heel on the lower portion of the sternum. The other hand will come on top, and you will lock your arms and your elbows, pushing straight down on the victim. You're going to provide 30 compressions at a rate of 100 times per minute at a depth of at least 2 inches. I'll demonstrate. A good idea is to count along as you're giving the compressions. Here's 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 2, 3, 4, 5, 6, 7, 8, 9, 30. After 30 compressions, come down, open the airway with a head tilt, chin lift. Pinch the victim's nose, seal your mouth around the victim's, and give 2 breaths. You should see a proper chest rise and fall if your breaths are effective. Come back to the victim, hands back in place, and give another 30 compressions. Make sure you're compressing at least 2 inches deep, at least 100 times per minute. And at the end of your 30 compressions, come down, open that airway, give 2 more breaths. You will repeat this sequence of 30 compressions to 2 breaths a total of 5 times, which equates to 2 minutes of care. At the end of your 2 minutes, recheck the pulse. If you have no pulse or a low pulse, you will continue with 5 more cycles of 30 compressions to 2 breaths. And that's how you provide adult CPR.